The surgery divides into two things, right? It's the initial operation that you get because you're symptomatic, and then it's some subsequent operation. When we looked at the data and published the data, we didn't find a big advantage to doing very radical surgery. So the paradigm, the analog is, we know that when I was a resident in the 1970s and 80s, radical mastectomy was what every woman got for cancer, for breast cancer, which was a horrible operation, and nobody gets anything near that anymore. When we looked at our data for GIST, we found that
SDH deficient GIST.
SDH deficient GIST. SDH, everything I'm going to say, everything I'm going to say is SDH deficient GIST, is that people look at it if they don't know it, and most people have never seen a case until they end up operating on it in the middle of the night, usually for bleeding or some other complication. They look at it as if it were carcinoma, like adult epithelial lining cell tumors. That's treated in a very different way than we treat GIST. For instance, the overall survival for SDH deficient GIST that when we looked at it was very close to 100% for many, many years. So right away that tells you there are other tumors like that. Thyroid cancer in young people and kids does that the same way. Right away that tells you that if there's not mortality associated with what's going on, then you probably don't want to be doing something that causes a lot of morbidity to treat it. You don't want to make the treatment worse than the disease. So initially, people will tend to want to do, for instance, I'll show a movie today that maybe gives you a better understanding of this, but they'll want to take out the whole stomach. Really what we advocate is taking out as little tissue as possible to remove the gross tumor if you operate. So that's kind of the initial operation. The secondary procedures are when and if to do something. We're not going to prevent, the biology of this tumor dictates what it does, okay? So all the genetics we've been talking about, and genetics maybe we don't even know about yet, dictate what these tumors do. But in my experience, and this is how I got into this, is that I would operate on a kid and I'd take out 4 lesions, and then next year I'd take out 9. And it just seemed ridiculous to be putting people through operations that have, complications and side effects and morbidity and hurt, when I know that I'm not affecting the natural history of the disease. So we really would advocate doing surgery well, first of all, you need it for the primary tumor because a lot of times that's the diagnostic maneuver, and the tumor may be symptomatic at diagnosis. Most of you may have had anemia or something like that. But then after that, and that should spare as much of the stomach or the organ, most of these are in the stomach, so as much of the stomach as possible. And secondly, if you see spots coming up on a PET scan or an MRI, it doesn't do any good to go in there and do some kind of a big operation where you kind of take everything out, because I can guarantee that next year you'll have twice as many spots or as many spots, okay? And you'll have gone through that operation with all that entails, and all that can entail in terms of adhesions and bowel obstructions later on and so on and so forth. We would advocate doing the secondary operation after the first diagnostic procedure, only if there's some kind of reason to do it. The reasons are bleeding. So I'll show you a case of an ulceration today that caused a lot of bleeding and anemia. That's a good thing to do. Obstruction of the intestine, since these don't tend to occur in the small bowel. That's not a common thing. Perforation of the intestine, as the tumor makes a hole in the intestine, that's again not very common. And then finally, and this is kind of a judgmental thing, if the tumor is getting big enough that it might cause those things, or it might get to the point where it would be very complex to remove. That's really a very light touch. Surgery is not going to be the answer to this disease. It will help. I think that it can be very effective in relieving anemia and bleeding and so forth. But surgery and radical surgery is not where it's at. And it's very similar to what we've learned about with breast cancer and what we're learning about actually with melanoma now. That we don't need to be very radical with these operations. that really we have to, what's really going to be important going forward are these clinical trials and these scientific investigations and development of knowledge.